Welcome back. We continue our discussion on men's health. And in this section, we will speak about what does science say about men's health. So my first question is to Dr. Sadowski. We learned that men die earlier and suffer more. What are the main causes of death in men?
Well, men die earlier of many different causes of death. It turns out that the genetic problem, as well as the men's environment and how they behave, are the main causes of death. Men die earlier from cardiovascular disease. They die earlier from most of the common forms of cancer. Men are more likely to commit suicide. Men are more likely to have accidents. And they do these at all younger ages. So unfortunately, men do really have a lower life expectancy than women.
Dr. Sadowski, these conditions that you mentioned are mostly shared by both genders, but are you saying that they happen more in men?
Well, men actually get involved in all of these behaviors and medical problems at an earlier age, partly because of risk-taking behaviors and not going to see a doctor. But let's take cardiovascular disease. It turns out that the risk behaviors and the risk factors for cardiovascular disease appear to occur at an earlier age in men than they do in women. So men are more likely to develop hypertension, more likely to develop diabetes, more likely to smoke, more likely to be overweight at younger ages than women. So unfortunately, cardiovascular disease can be a problem at a younger time.
So Dr. Fish, what are the specific diseases that affect men and are of high impact in men's health?
Well, when we're talking about men's health, we talk about general issues such as heart disease and cancer, and we do know that men who have heart disease are at high risk of having other problems. And you know what problems they really have, Dr. Ridwan? They have sexuality problems. We know there's a heart hormone connection. We know that men who have heart disease may have lower testosterone levels, which leads to erectile dysfunction. We also know that men who have hormonal problems may have a higher chance of having a worse case of prostate cancer, something that a lot of us are not aware. The lower the testosterone, even prostate cancer may be a higher issue. So when men were talking about their issues, the heart disease, the portal to men's health, which is heart disease, and the cancers, and the most common is prostate cancer, and of course we have urological problems such as men going to the bathroom too frequently, a condition called benign prostatic hyperplasia.
Well, it's very interesting that you mentioned that sexual health is the portal to men's health. When you say a portal, you build in my mind something that has a wall around it. Does men's health have a wall around it? What is that wall?
Well, in general, as we say, men are in denial. So, but I want men to understand very simply, you can tell if you have a problem. Do you have the risk factors for having disease? And really, the major risk factor is the erectile dysfunction. And I like to say, in addition to portal to men's health, the penis is the dipstick of the body's health. And that's right, the dipstick of the body's health. Because if it's not working, you may have heart disease, hypertension, and higher risk of having cancers and dying from these diseases. So let's not be forgetful, and let's make sure that we know that we have to go to the physician. You have a problem if you're having erectile dysfunction and those issues.
Dr. Sadowski, something attracted my attention in your explanation is the risk factors and the behavior of men in terms of health, which brings to me that these are things that can be changed, can be modified. What are examples of things in men that can be changed that are risk factors for health?
Well, we can do a lot actually to help men become more healthy and stay more healthy and live longer lives. Number one is that we need to try and reduce some of the risk factors. And in order to do that, we need to get them into their doctor's offices. And we need to explain to them a little bit about what Dr. Fish was just discussing, about the idea that sexual dysfunction, often caused by vascular disease or low testosterone, are also signs of cardiovascular disease or cardiovascular disease risk factors. So we need to educate men, we need to get them into our offices, and we need to treat their risk problems earlier to prevent cardiovascular disease and other medical problems.
You know, I can't agree with you anymore. I like to say that men need 5 numbers to really know when they go to the doctor. You got to know your blood pressure. You got to know your glucose level. What are your lipids, your cholesterol level, right? What is your PSA? And lastly, what is your testosterone level? Because it all revolves around these numbers.
So we have heard recently that there are a number of universities and medical centers that are catching up in establishing men's health initiatives and men's health centers, similar to what had happened in women's health. We know that women's health is very advanced in a number of areas for many years. So if I were to ask you, Dr. Sadowski, what is exactly the definition of men's health?
Well, I think the original definition of men's health was somewhat confined to urologic and sexual problems, prostate diseases, urinary problems, and sexual health. Right now, we're recognizing that there are many, many more aspects that are specific to men's health that we need to address. The prevalence of certain other diseases that we talked about, of risk factors, of risk behaviors, of aversion to going to doctors. These are all issues that are important in men's health. So it's actually a very big area that requires lots of study.
Very interesting information on men's health from our top experts here. This is Dr. Ridwan, the Dr. Ridwan Show. Health information you can use. Stay with us, and we shall continue.